confusing for people sometimes.
We're going to get into this in just a moment. Our own Jonas Cheney went out in search of an answer to a related question. What exactly does informed consent mean?
Informed consent, I'm honestly really not sure how I define it. I know how I feel about how things transpire. When you ask me to do something or you do something to me or for me and I don't know about it. So informed consent, that's something I think that needs to be explained.
Okay, let's explain why this terminology can be so confusing.
Well, I think informed consent basically is confusing to folks because they don't often think that when they deal with a doctor, they have to kind of look out for themselves and give permission for what the doctor's going to do. They want to trust their doctor. So when you want to trust the person, you're not really looking to say, would you please be sure to tell me all the risks, all the benefits, and all the options. That's kind of what you might do with a lawyer or someone you thought was trying to sell you a used car. It's not exactly the same as dealing with a physician.
But building trust outside a clinical environment in the community where people live, work, play, and worship is a brand new paradigm. One that arrives less than 15 years after former President Bill Clinton makes a public apology for the infamous experiments at Tuskegee. And just when we get a handle on that, comes this.
There was an extraordinary apology today from President Obama for something that happened more than 60 years ago. The U.S. conducted secret medical experiments that involved intentionally infecting Guatemalan mental patients with sexually transmitted diseases.
The secret experiments took place in Guatemala between 1946 and 1948, financed by the U.S. government and supervised by U.S. government doctors. Close to 700 Guatemalans were inoculated, including prostitutes, institutionalized mental patients, and prisoners. The subjects did not give their permission and were not told what was happening. Said the Surgeon General at the time, quote, "We couldn't do this in America." Fortunately, says Dr. Rhonda Johnson, it's a new day in the U.S.
We need therapeutic advances just like everybody else. It's time to forget some of the legacies of the past. It's time to move on past Tuskegee and some of the other medical experimentation that has been done in the past. This is a new day, and there are procedures in place so that people don't have to worry and feel like they're going to be victimized as in previous times.
Dr. Kaplan says the one-size-fits-all approach to drugs and vaccines is now passé. It's not that medicine is trying to be racist, says Kaplan. It's just that medicine is trying to be fine-tuned to the individual differences that people bring when they get sick.
We need minority participation. We need African-American participation in research because we're starting to move toward an era where drugs are designed for the individual. No more one-size-fits-all. Now it's, Art Kaplan, you need this blood pressure medicine because it's not going to cause side effects and it's going to be very effective for you, even though it's not going to be effective for maybe other people in your community.
But Kaplan says he still understands why some minorities remain skeptical.
People remember that we actually had within the living memory of a lot of older African Americans segregated wards. And there was a lot of racism in the healthcare system. They remember that. They wonder, if I can't get into this hospital for care, why am I going to go there to do research?
All right, Dr. Thomas, do you agree with what Dr. Kaplan said about existing mistrust, especially among older African Americans?
Well, yeah, I think Dr. Kaplan was right on target. And I think that the mistrust that we have documented in the African-American community and other communities is legitimate. And that's exactly why we have a program like this and a town hall meeting like this focused on how to overcome those barriers.
Dr. Quinn, your thoughts on this as well?
I think it's critical right now to acknowledge the past but move on to the future. If we really want to eliminate health disparities and improve health for all people in the U.S., then we need to have everyone participate in an informed way in research.
Yeah, there were some positive takeaways from Jonas's piece, despite the references to Tuskegee and Guatemala. There's tremendous potential with the new paradigm. Let's check in with Darian, as she has a question or two from the audience and one of our panel members. Darian.
David, this one perhaps for Dr. Thomas. Several guests in the audience